So, Namaste. On behalf of Mallareddy Cancer Institute and the Research Center, I welcome you all. And I am Dr. V.M. Shankar Reddy, Senior Surgical Oncosurgeon and reconstructive and laparoscopic surgeon. So here, when we come to the cancer, I think majority knows about what is a cancer, and there is a fear, and there is some of the stigmas that are associated with cancer is there prevailing in the society. So I am here just to clear few of them. Like basically the cancer means it is an abnormal, unwanted proliferation of the cells, which replaces the nutrition and the livelihood of the rest of the normal cells, so that this cancer cell will progress and it will extend from one organ, the site of the organ where it starts, and it can extend to the different organ. So based on that, we'll label the cancer into stage 1, 2, 3, 4. Stage 1 is localized to that particular organ. Stage 4 is the distance organ metastasis. And in between, you will see the stage 2 and stage 3. That's where the most of the crux lies. So when it comes to the what are the common causes of these cancers? Common causes of the cancers are majority feel it is the so genetically related. Yes, but the number is very few. It is around 5 to 10% of the cases only. You will see the genetically predisposing issues. Otherwise, most of the cases they are all the sporadic cases. Like it spontaneously occurs because of our lifestyle habits and bad habits related to our routine lifestyle and some of the food habits, environmental factors, and dietary changes. These are the major thing that is causing the other sporadic causes. If somebody get the cancers in the women, most of the time it is related with the hormonal and their body nature related cancers. But in men, it is mostly self-inflicted due to the tobacco abuse. In any form, you can take the tobacco. So tobacco, that is either smoking or non-smoking form, that is most common in India, that is the tobacco abuse. So when they take, they are more prone to get it. So this is oral cavity, that is the mouth related cancers and the voice related cancer. And the smoking is one of the worst carcinogen that is labeled by WHO. It has almost more than 150 carcinogens, and that is going to cause any cancer in any organ. So that is the bad effect of a smoking. And when you add alcohol to this, so you will get that multiplication factors. So when you take a smoking, if it is a 5% risk and alcohol adds another 5% risk, actually it is not like a 10%, but it goes to 25% of the risk, because the smoking carcinogens will be more activated with this alcohol. So these are the cases that we can almost most of the time we can avoid because of all the lifestyle changes. So then how to detect it? So if you come with some symptoms, so definitely some symptoms will come from the body, and very few it will go unnoticedly. They are the like this abdominal and the thoracic kind of the diseases. So when it comes to the routine identification, the best is a screening. Screening is very simple, like for most of the women, and we have all the screening protocols here in Mallareddy Cancer Institute and Research Center. And we have a dental examination, we have a breast self-examination, we guide people for self-examination, and there is objective assessment will be there, and some of the basic tests like mammography we do it, and ultrasound we add as a complementary to identify more specificity about the disease. And abdomen of the ultrasound of the abdomen also will add us to identify early diseases. Depending upon the any doubtful lesions, we always go ahead with some kind of the diagnostic modality. Mostly we take a biopsy, and we have a specialist in that, and that is the interventional radiologist is available even to take a deeper biopsies from any corner of the body. So once we get into the diagnosis, the treatment is the main crux. Once we get a diagnosis, we stage a disease. After staging this disease, and we have the multi-modality treatment, we take opinion through our multidisciplinary tumor board system, and we have all specialists that includes surgical, medical, radiational, and the nuclear medicine, and associated with other supportive system of a nursing, onco nursing, and we have a good pathology system here, so that Once we identify the disease, we stage the disease, we plan the disease. After planning and accordingly, we'll take into the surgeries. The most common surgeries that we are going to perform is from this head and neck. We do a lot of oral cavity, and we do reconstructions, free flaps in that oral cavity surgeries. And most of the head and neck surgeries, we have a good reconstructive surgeons. And when it comes to the breast and it's related, and in the olden days, we used to do a complete removal of the breast. Now we could able to get away with a partial removal of the breast depending upon the stage of the disease, and we are good in reconstructing of this. So that's called as oncoplasty techniques. We have a good reconstructive surgeons, so that we can replace whatever the breast that has been removed, so that the patient will get more confident when they move in the society, and the treatment will be good in these patients. So abdomen, most of the abdomen and the retroperitoneal organs, thoracic. So we are doing a thoracoscopic and laparoscopic surgeries. Some of the esophagus surgeries, we do thoracoscopic mobilization and the laparoscopic conduit management. And we most of the abdominal cases we do under the laparoscopic. And when it comes to the gynae and everything, also we do the laparoscopic oncological surgeries. So we have a team of a musculoskeletal as well as the bone surgeons. So where we get a complete modular prosthesis depending upon the need, and any local reconstruction also will be done better. And post-operatively, the laparoscopy and the reconstructive surgeries, and we are subjecting patients as early as possible. So that will be minimum of 4 weeks and maximum of 6 weeks. We'll subject all the patients to the adjuvant therapy either in the form of a radiotherapy or a chemotherapy. The post-operative care, and we have a daycare center for a chemotherapy, and there is a social worker who can take care of their basic necessities, and we have all kind of the credit cases also. We do a Aragasri and EHS, CGHS, ECHS, and we have all kind of the other insurances also that are available here. So I request all of you to make use of these services and get benefit. And first of all thing, identify, screen for yourself, identify any disease, come to us. We are there to help you out every day. So we will be available into 24/7. So thank you.